is that we've been able to get much more advice from autistic people themselves, and they've really informed the debate over the last few years. It's really helped us to make a lot of adjustments, and sometimes very small adjustments make a massive difference to the quality of life for people. The things that trouble me a lot are things like health inequalities. We've got to work a lot harder to ensure that people can access the services they need and get the medical support that the rest of us kind of take for granted.
It's the change in attitudes as well, isn't it? That seems to be the key thing that runs through all of this.
You can't deliver services unless you understand the person.
Hi everyone, and welcome to This is Autism, the podcast from the North East Autism Society. My name is Kerrie Highcock and I'm the Family Development Manager at the charity. Today we're going to be talking about autism acceptance with someone who many of you know very well, our Chief Exec, John Phillipson. John has led the North East Autism Society for over 20 years and has been instrumental in shaping our values, our services and our commitment to creating a more accepting society for autistic people and their families. His leadership has helped the organisation grow significantly, and he's been a strong advocate for moving beyond awareness and towards genuine acceptance, inclusion and respect. So John, thank you very much for joining us today. I know you're very, very busy.
Thank you very much. That was a really generous welcome.
All well deserved. So John, we're just going to jump straight into it. Autism Acceptance Month is coming up, but as we say here at North East Autism Society, autism acceptance is for every day of the year. And just with that, I guess, how do you define it? What does autism acceptance mean to you?
Well, I think for a lot of years we had campaigns that were about raising awareness, autism awareness weeks, and etc. And I think the public learned a bit through those campaigns, but really we wanted to move from just having an awareness of autism and neurodivergence to actually making a difference in the way that we deliver services and the way that we approach our work, so that adjustments were made, changes were made that made things much more acceptable and accessible to neurodivergent and autistic people. And one of the great things I think that's happened in the last few years is that we've been able to get much more advice from autistic people themselves, and they've really informed the debate over the last few years. More and more we've got people working in universities doing research who are autistic themselves and have lived experience, and people who are helping to create policy and co-producing policy documents and advice. So it's been a fantastic journey, really, but I think it's really helped us to make a lot of adjustments, and sometimes very small adjustments make a massive difference to the quality of life for people. And I think that's been one of the things that's been great about autism acceptance. And the more that autistic people share their experiences and the more that they're in universities carrying out research, the better informed our work is. And I think it's been a real learning curve over the last few years that's been great to be part of.
Absolutely, I would totally agree. So John, what do you, obviously you've been in the business a lot of years now. Mm-hmm. What are you, and I'm not going to give your age away there, but what would you see as some of the main challenges and barriers to autism acceptance?
I think one of the big challenges of the moment, and sadly it has been over the years, is people's understanding of autism. And I think that, we see every day of the week, we work here with different individuals, children, young people and adults who really have challenges in life because of autism, and parents, advocates, etc., really struggle to get the services that they need because people don't understand autism. And I think what we're also seeing at the moment is, there's snake oil salesmen around who are talking about cures for autism and treatments for autism, which takes us back to the days when it was thought of as more of a condition or an illness. It was pathologized. And I really hoped we'd moved on from that. But, we're seeing that from some notable political figures and also some academics, which is really very sad. Mm-hmm. But I think that that is one of the challenges, and what we must not do is allow the sort of clouds of confusion that people create to stop children, young people and adults getting the kind of services they need. We do see autistic children, adults and young people all of the time who really have challenges that could be removed with the right kind of funding and support.
Yeah, absolutely, John. Couldn't have said it better myself. So obviously, you know, as the CEO here at the charity and drawing on your experience, what would be a vision for the future for autistic people and their families? What would you like to see?
We'd like to see services open and available to them that are available to the general population. You'd like to think that, you know, if it's things around leisure, that people can go out and have a really nice day without being judged, without feeling uncomfortable. You know, with the charity's developing a farm at the minute to make it a visitor centre, etc. And talking to parents, what they really want is to go somewhere where they can have a lovely day out, where nobody looks at them strangely if their children are making happy noises, or if they're pogoing, or if they're just, you know, having a good time. And I was talking to a parent a couple of weeks ago about her adult family member, adult son, who just wanted to play on swings, just wanted to go to a play park and play on swings. And she felt that the people in there were going to phone the police, or, you know, they're looking at her really strangely. And it was just that it was an adult who wanted to play on a lovely swing. What's wrong with that? So you'd like to think that, you know, as we move on, we're going to be more accepting and more understanding, and these things would be more available, and people would feel more comfortable to use them. But the things that trouble me a lot are things like health inequalities. You know, what we've really got to do is make sure that those kinds of services are available. I was reading articles recently about breast cancer and how it's a major killer for women, and we need to improve breast screening. And then talking to people who are providers of service, and people were not aware of whether their service users, people living in their accommodation, etc., were being screened. And we know that, you know, life expectancy for autistic people is lower.
Yeah.
Similarly, if you look at prostate cancer, for example, or testicular cancer, things that we know are a major challenge health-wise for men, are we doing enough to screen? And then on top of all of that, there's all of the challenges around in reception, people not knowing whether they feel pain or where they feel pain or being able to describe it, issues around communication. We've got to work a lot harder to ensure that people can access the services they need and get the medical support that the rest of us kind of take for granted.
Yeah. Absolutely, John. I couldn't agree more. And I know as an organisation, we've done a lot of work with, you know, local hospitals, local A&E departments, local outpatients to try and just change things. And we're often not talking about big changes, are we? It's just little things.
Small things.
And I think, as you just touched on, it's the change in attitudes as well, isn't it? That seems to be the key thing that runs through all of this.
Yeah, there's a great example. I'll not go into a lot of detail because it would identify the person, but we've got a young man who had a range of health issues, and through a collaboration with the hospital and the consultants involved, we're able to help him he had a bit of a sedative to make him feel a bit relaxed. The hospital put cones out so that our vehicle could swish in and park. He didn't go in through the main reception area. When he got into the hospital, he was sedated, and 3 different medical professionals came in and carried out the tests and work that they needed to do. In this case, it was, you know, his throat was checked because there was concerns about his throat. There was an examination of an eye issue that he had, and he had some teeth filled. And at the end of all of that, he went back to where he lived, and even the anaesthetist came back to the residential home just to make sure that he was okay. Now, I think that's an exemplary piece of work, but if you can do it once, it can be replicated time and time again, and we can improve the kind of health services that our service users get and that people can get more generally. But it's not just in health, it's everything else, isn't it? It's about housing and people making efforts to get the right kind of housing in the right areas.
Yeah. Education, social care.
Education, social care. Anyway, I was doing some work with our advocates recently, and they were talking about airports and how difficult it is just to go on holiday, the challenges that arise from visiting an average airport. So my hope for the future would be that people would plan and listen to the lived experiences of people and see that we adjust how we deliver services to make them much more accessible.
Absolutely.
Brilliant vision, John. So you have been with this organisation for a long time, and I know you've been in lots of other organisations. You have quite a long and varied career, and you've probably seen a lot of changes in society, John, I would imagine, over your career. And I guess this is a really big question, but what are some of the key lessons that you've learned over the years about autism, about acceptance, about social inequalities? Is there anything that really stands out for you?
I know this is going to sound really obvious, but often people design services and systems with really good intentions, and then they rigidly stick to them and apply them. One of the things that I've learned over the years, and it applies to providing services for autistic people, but it applies to other groups as well. You can't deliver services unless you understand the person. You start with the person and you get the best understanding of them that you can, and what their fears and ambitions are, what motivates them, and then customize or personalize the services around them. And that's the only way I think you're going to get the best of services. And we've tried here, as you know, over years to really look in detail at, for example, children in our school and how do they process information? What are the things that affect their day? What are the things that cause them excitement and get their interest? And what are the things that cause them fear? And you try then to create a program that addresses all of those things so that they come into school happily, they enjoy it, they access the kind of lessons that they need that are pitched in the right kind of way. And I think only by personalising everything that we do, we get the sort of results that we get here. And I think it'll be a lesson for policymakers to really try and get assessment at the heart of what we do, but not, drawn out, resource-heavy assessment, just a good enough understanding to provide good services.
Yeah. It's about the detail then, isn't it, John? I guess you're talking there about really looking into the detail, because you could have a textbook understanding of what it means to be autistic from 1943 as an example, but that's not actually going to tell you anything about the person that's sitting right in front of you right now. It's about that detail. And I think you mentioned before those interoceptive understanding of how people process their internal body sensations, and that links a lot to what you said about the health inequalities, I think, because what we've got now is a lot of children, young people and adults that can't identify pain, they can't identify when they're feeling unwell, and therefore we're missing, this is about people's lives, it's about mortality, isn't it? We're missing those cues because we might not understand what interoception as an example means. So it's really, really about the detail. I think that's what you're saying. What about relationships, John? Are they important?
Well, absolutely. I mean, the program that we have really looks at the detail and tries to understand the person. But then if you're the person providing support, the best support you can get from anybody is from somebody that you trust, somebody that respects you and cares about you and who wants the best for you. And if you know that if you've got that trust in the relationship, then you can make a lot of progress. But I think people need to know that somebody's got their back, somebody's there for them and has their best interests at heart. So I think trust's a massively important thing, and that trust only comes from selecting the right people to work in this kind of service and having people stay in the service and learn. And when I say learn, you said you could have a book from 30 years ago. Equally, you could have a book written this year. And if they don't actually spend the time to observe and watch and care enough to understand, they're not going to be the right kind of people to provide the support.
Absolutely. I think, we've had many discussions over the years, haven't we, about, you can have as many qualifications, as much experience, but if you've got the wrong values and attitudes, then it's never... it's never going to be meaningful, is it, for the people that we support? And we've got to do better. We've got a duty to do better for children, young people, and adults out there, haven't we?
Yeah,
and all of them.
Every week we look at the incidents and episodes, things that have happened, good things and bad things across the organisation. And one of the things I'm always really amazed by is the extent to which our staff really look at the detail of somebody's life and understand exactly why something happened in a particular way, or understand the things that somebody really likes, or the things that calm people in different situations. Sometimes awestruck by the extent, the lengths that people have gone to do that. But that's great. That's what you really do want, because it's those details that make such a huge difference.
Absolutely. Well, John, thank you so much for joining us today. That has been a really wonderful discussion, and I could speak to you for hours really about this stuff, as we have done in the past. As we have. But thank you so much for taking the time to speak to our listeners.
Thank you very much.
And to all our listeners, thank you so much. If you've got any questions or comments about anything you've heard, please get in touch at info@ne-as.org.uk. You can also follow the North East Autism Society on Facebook, Twitter, Instagram or LinkedIn. The podcast This Is Autism comes out each month, and you can subscribe on Apple Podcasts, Google or Spotify so you never miss an episode. So bye for now.